So I know I told John a little bit about y'all's story, and it's crazy. I live, day by day over here with Courtney talking to you, and y'all just didn't have a very good experience with the hospital. And I know y'all were on the news and talked about it briefly. I don't know if y'all were able to get the whole message out, but it's just it's a crazy story. We were praying for you guys every day, like every dinner. Yeah, as Ashley and Josh, it's crazy because I want y'all to tell the story, but it's against all odds. You came through, and now you're like healthier than ever, running around with the kids. I bet you feel like you got a second chance of life too. I can't imagine that part of it too. But I'll let you go and introduce yourself, and we know you through the family too. Courtney is real good friends with Ashely, and both of y'all through school. So y'all go ahead and introduce yourselves.
Yeah. So my name is Josh Lara. 32. Grew up in Lamport. Basically all my life. Just moved the street over to Deer Park, but Ashley's probably gonna be the one mostly talking to y'all because she knows everything that happened. All I know is just briefly before, getting to the first hospital, and then shortly after, waking up, I know what happened after that. But as far as when I was sedated, Ashley knows everything that happened. So, yeah.
So I'm Ashley Lara, grew up in LaPorte as well. We've been together since we were 15. Met in high school, been together ever since. I don't know what else y'all want to know. We have 3 kids, 6, 5, and 7 months.
Yes, and during that time,
Josh went into the hospital 3 weeks after the baby was born. So, and then he came out when the baby was 4.5 months old. So you missed quite a bit of time there. You missed all the, waking up all night long. He got out of all that.
He did that on purpose.
I told him if he wanted to get out of that phase, he didn't have to go to the hospital. It would have been great. He could have picked something else.
And how is the progression? So Josh got COVID, and did y'all try to self-treat at the house for a little while? Okay. How'd that go?
Yeah. So I was, of course, quarantined in our bedroom. Once we found out I got positive on a July 4th weekend, and it was the first 4 days just your random, scratchiness and sniffles. With me, my allergies. That's what I kind of figured it was, but. Turned out, it was COVID, but just about the 4th, 5th day, that's when it started kind of kicking in with the fever. I believe, was eating fine, I was drinking water like no other, at least a gallon a day. And then, I think by the 6th day, that's when I started.
Sorry.
You're good.
It has that
Zoom.
Dun, dun, dun.
Come on.
So you got COVID in July, Josh, and that was the peak of the Delta wave. Is that what strain you got? You got the Delta?
So they didn't state exactly which one I had, or assume, we're assuming that that's what potentially I had. But the hospital, when they tested, I guess that's the only time you actually know what you got is at the hospital. But they were mainly at the hospital testing if I was still positive or not. But didn't really care what I had. But yeah, man. So it was just I lost taste and smell probably by the 6th, 7th day. that's when my oxygen level started dropping to about 90.
And how'd you know that? How are y'all testing
we have a pulse ox that my wife, her being in healthcare, she has to have a pulse ox. So I would check it probably about every 30 minutes. I would check to see, and I would be sleeping on my side, proning, which is sleeping on your stomach, to help with the breathing better. And the first time I went to the hospital, they, checked me, but then sent me home with just medication, cough medication, inhaler, but did tell me that if it did drop lower than 90, that I needed to come back. So then about the next day, about 2 or 3 in the morning, I woke up with my shortness of breath. And then once I checked it, it was about 85.
So at this point, I had already tested positive too. So I was quarantined downstairs with the baby. I had tested negative, so I stayed downstairs with the baby, but I kept a mask on just in case. But it ended up, I tested positive like 7 days later. So I actually went and picked him up from the hospital that night because his brother took him. So I was like, I'm positive. Might as well go pick you up in the car with me. So I went and picked him up, and then we had sent the baby to his mom's house because we thought that was the best thing to do. Our other kids weren't with us. They were away for the weekend with my mom. So they just stayed there. We kept them away.
And they let you in the hospital? It was really crazy at that moment. Like nobody could visit.
No, I had to he just walked out the door. When I took him back the second time at 2 a.m., I had to roll him into the door, and then they wouldn't let me go any further. I just had to drop him off.
Yeah.
Even though I was positive too. They were like, sorry, you can't come in. Like, you just need to drop him off. And he couldn't even walk in the hospital. I had to roll him into a wheelchair to the door, and then they took him.
The first time that you went to the hospital, they didn't suggest monoclonal antibodies or anything like that. Did y'all try to do anything like that at first?
They had said it was too late,
which it wasn't at that point. Yeah, but that's what they had told him.
Yeah, because you're 6 days, right, or 6-7 days when you went in.
So you tested positive on the 4th. You first went to the hospital on the 8th. So he was only 4 days in, and they sent him home. And they were like, "You're young. You should be fine. Like, take these medicines," and didn't ever offer it, which we didn't know at that time. We didn't know any better. So we're like, okay, cool. But then once he went to the hospital on the 10th and they admitted him for the shortness of breath, I went and got the antibodies. But I had to go to a different hospital to try to get a referral. And then from that referral, I had to wait 3 days and go to Memorial City to get the infusion. It was really hard. They didn't want to give it to me.
Yeah. They had also said too that they weren't, that they didn't have it
at the hospital.
At the time. So yeah, after that I got admitted, and that's kind of when it got worse. Coughing a lot, just coughing up phlegm, and I believe that next I had stayed one night on the 4th floor, and that next morning they put me in the ICU. It was basically where I was at for the next 2 weeks, was the ICU. And of course, my oldest brother, Joey, he is a respiratory therapist who works there. And my sister-in-law work at that hospital, UTV in Clear Lake. So, so that's whenever things took, the wrong turn. Didn't know anything, didn't know what was going on, in a way, which was kind of good for me. Just was going with it. Doctors would just come in and say, "Hey, how you feeling? How you doing?" And I'll be like, "Oh, doing good. What's next? Is there some medication? Is there something, just something?" They come in, take x-rays on my chest. And my brother, would come in and put high flow on me. And didn't know anything as far as my numbers where they were at.
Like oxygen level? They didn't like keep you updated on it?
Yeah, so they do like a blood gas test where they take your blood and they run it in a machine, and it basically tests how you're exchanging like carbon dioxide, how much your blood you're getting, how much oxygen's in your blood. And so they base it off of that. So like a normal person, I think, is like 90s. So they would test him like every couple of hours to see where he was at based on how his lungs were exchanging the oxygen in his blood. So they were basing it off of that. They were basing it also on a pulse ox that they had on him. And then just on like his work of breathing, how hard was he working to breathe based on what oxygen settings he was on.
So what was, like, based off all that information, were they giving you anything other than cough medicine? There wasn't like vitamin drips or some of the other
No, so
treatments?
we tried to ask for vitamins. They gave him some, but not very many. They had him on remdesivir, which at this point now, I wish I would have asked them not to give that to him, but I didn't know any better. And then they had him on a steroid, which is the dexamethasone, which is, I mean, the steroid's good, but I wish I would have asked them not to give him the remdesivir because it literally did nothing for him. And we've come to find out now that it can cause kidney failure in people. And so if he would have had any kind of kidney issues, they wouldn't have been able to put him on the ECMO. So, wow. I mean, thank God that medicine didn't cause him any problems, but it could have, and could have hindered a lot of progress. But they had him on that. They had him on the steroid. They had him on, I think that was really it.
Yeah, just fluids.
Yeah, and then just like IV fluids.
What day did he start getting all that medicine? Like within the days of him having COVID?
Like right when he was admitted. So I think it was like a 5 or 7 day treatment of remdesivir and then like 10 days of the steroids. So they started it like the day he got admitted. And I mean, it didn't do anything. Obviously, he just kept getting worse and worse and worse. He started on the regular oxygen, and I think that goes up to 15 liters. And then that got to where that wasn't enough. So they put him like on the high flow oxygen, which I think can go up to like 50 liters. And then from there, he had to go to CPAP, which is even higher. But they would take the CPAP off of him and put him on the high flow during the day. And then he would have a coughing fit and like wouldn't be able to recover. And that's when his oxygen would really drop. And he had a couple of those episodes when that happened. And then the last one, he just couldn't recover from. Like, he had to be intubated. They called me at like midnight and they were like, hey, sorry, we have to intubate him. And he had said no the entire time. Like, no, I don't want to be intubated. No, I don't want to be intubated. And so finally our sister-in-law was there the night he got intubated, and he asked her, like, should I do it? And she was like, you have to. Like, you don't have an option. Your oxygen's not recovering. You need to do it. And so.
Yeah, they were actually gonna wait until I coded to intubate me.
Because he kept saying no.
So either way, they were gonna intubate me no matter what.
Is that possible to code and then put you on, get you into it?
Yeah. So one thing that my brother was telling me is that for 2 weeks of me being in there, I was sitting at 60 for the oxygen. And they're like, there's no one that I've seen that's been through here could stay that long
without being
intubated on 60. He's like, I don't know if you were just stubborn or, we're just, I don't know, mentally strong or whatever. My sister-in-law was there, and I listened to her, and I said, all right, well, do what you got to do. And intubated me. And then I believe that was the time they were trying to figure out if they were going to put me on ECMO. They had requested it. And of course they got, I think, from some certain doctors that were on my shift, denied it and basically said no. Until I believe a certain doctor came in and basically stuck up for me, I think, or figured out who I was and stuff like that. And they finally cleared it for me to be on ECMO.
So all of that happened within like 24 hours. So he was intubated at like 2 a.m., I think. And we had like immediately requested ECMO. But the problem is that to be a candidate for ECMO, you have to have no underlying health conditions whatsoever. You can't have any other organ issues. There's like, so age is a big deal. Like there's so much that goes into it. And of course, the hospital he was at didn't have ECMO. So wherever he got approved, we were going to have to lifeline him.
So hold on. But I think a lot of people know what intubation is now because of COVID, and I don't think a lot of people did before. I know I really didn't. With my cousin too. He was on that for a little while. But I don't think a lot of people know what ECMO is, and that's something I didn't know either before Courtney informed me of that. So for like the listeners and viewers, what is that?
So ECMO is basically a machine that can work as your heart and your lungs. There's two different settings where it can do your heart and your lungs, or it can just do your lungs. So you have a big like needle that's probably like this big, a cannula that goes into your jugular artery. And it pulls all the blood out of your system, puts it in this machine that works as your lungs, oxygenates it like your lungs normally would. And then he has another needle going into his groin where it puts the blood back in like your lungs would normally do. So it's a big surgery that they have to do, not a surgery, they do it like bedside, but they have to like cut it open, put the cannulas in and start drawing the blood. And basically it works as your lungs so that it's not something that's going to cure COVID, but it gives your organs enough time to try to rest and not have to work, and basically does it for your lungs. It's very rare. It's not ever really been used for COVID. It's normally used for like other people, like cystic fibrosis or heart disease, people waiting for transplants. They put them on it to like sustain their body so they can be able to get transplants. So it's just recently been starting to use for COVID. I think I looked at the statistics, and out of the entire world, there's only been like 12,000 people that have been on it for ECMO. For COVID.
Wow.
So it basically just works as your lungs to give your lungs a rest so that, they can try to heal by themselves.
And thank you for explaining that to us, because
You're welcome.
I don't know if John knew about that.
No, go ahead.
You got it.
I wanted to, so how is that different from the ventilator then? Because the ventilator helps your lungs breathe, right? I mean,
yeah. So when you're on ECMO, you're still on the ventilator as well. You're on both. So it's basically double life support. They put you completely on the ECMO and they turn your ventilator all the way down to like toddler settings, or you can be on the ECMO and need the ventilator too. So the ventilator pushes air into your lungs to make your lungs work, whereas the ECMO lets your lungs rest and works as your lungs for you.
That's pretty scary though, because you always hear that the ventilator is the death sentence with a lot of people that
and that's what I was terrified of the night he got intubated. I'm like, because my sister-in-law who works at the hospital, she's always said, like, once they go on the ventilator, they don't have a good chance of surviving. So the minute they told me that they were putting him on the vent, like, I was like, that's it. He's done. Like, I'm not going to see him again. And I couldn't go to the hospital to see him. So, I had FaceTimed him a couple of times in the 2 weeks that he wasn't on the ventilator, but he was not very happy and not very friendly and very angry at the situation. So, they weren't really great conversations. He really didn't want to talk to me. The nurses had to pretty much force him to FaceTime me so that I could see him, that he was okay. Because other than that, I got no other communication other than calling the hospital every 3 hours to check on him and see how he was doing. So the decision to put him on ECMO all happened within 24 hours. He got intubated at 2 a.m. and then the next night we were lifelining him to Galveston, which they told us like may not happen. They were like, he may not survive the life flight. This is a very big risk you're taking. And we're like, you're already telling us he may not survive. So why not take the risk to lifeline him for a better treatment? And so we did that. That was a very expensive ride from Clear Lake to Galveston.
Oh, I bet. If it's anything like a damn ambulance.
Yeah. So he had to fly life flight. It took about 45 minutes for him to get there, get settled in. And then they still didn't put him on ECMO for another week. So he still just stayed on the ventilator at Galveston, thinking that they could do something different that Clear Lake didn't do. And we're like, hey, we life flighted him over here for ECMO. Like, why are you not putting him on it? And they just kept saying like, oh, well, he's making improvements. He doesn't need it. And so that's where we were there. And then one night at the middle of the night, he come to find out what happened was he was had his ventilator through his mouth, and it had come out, and he completely decompensated to where he like lost all of his oxygen. And I had called to check on him, and they were like, hey, he may have hours to live. Like, we don't think he's going to make it. Like, you need to come up here. So, I mean, at like 11 o'clock at night, me, all of his brothers, my sister-in-laws, we all drove to Galveston, and we got approved to be able to look at him through a glass. We couldn't go to the room. They let us go 2 at a time just to look at him, and say our goodbyes through the glass. So that's what we did.
And I remember that night, because I think it's that night you called Courtney,
2 a.m.
and we were in just complete shock. And how many days were you in Galveston before they called you?
It was about a week.
About a week.
So he went into the hospital on the 10th. He was there for about 2 weeks. We life flighted him to Galveston on the 24th of July, and he was put on ECMO on July 31st that night. So from the 25th to the 31st, they just didn't put him on ECMO. They just kept being like, he's okay, he doesn't need it, he's okay, he doesn't need it, and just kept passing it off. And we're like, but this is why we life flighted him here. Like, you're not doing anything different than they were doing at Clear Lake. So if that was the case, we could have just left him at Clear Lake and not life flighted him
and took the risk.
Took the risk of him dying in the helicopter.
So what were the improvements that they were saying? Like, if he was making improvements, what were they? They
were just saying that they were able to like wean the ventilator a little bit, that, he was tolerating them turning down the ventilator some. And really, he was making progress of them turning down the ventilator, but the night that they called us up there and told us he wasn't going to make it, they tried to say that there's a lot of like inconsistencies, a lot of good things that didn't happen at that hospital that we have complaints against. But they tried to tell us that he decompensated on himself, like he lost his oxygen by himself. And they kept saying that, he had a cuff leak, which means like the tube that's inside the ventilator, that's inside the tube that's in your throat, that it kept leaking. And so they had to keep going in there and airing it up. So what they tried to tell us was that the leak caused him to decompensate, and they had to re-intubate him. So they had to take his other one out, which caused him to lose all of his oxygen, and they had to put another one in. And they kept telling us that they didn't want to do that. We don't want to do that. We don't want to do that. And I called to check on him. They're like, oh yeah, he's fine. Nothing's changed. Blah, blah, he's fine. And then like 10 minutes later, I called back and they were like, hey, he's not going to make it. You need to come up here now. And so...
And that conversation was interesting, right? Because you got the call and then you started questioning, and nothing really added up.
Yeah.
Right? So
they were trying to say he was fine. And I'm like, okay, no, something's going on. Because I looked at his my chart. At this point, I had gotten access to his my chart.
Yes.
And it showed like an anesthesia note that he was reintubated. And I'm like, wait, like I just called and you said he was fine. So how is this note in here that he was reintubated? So when I called back, they were like, and I'm like, no, I need to speak to like a charge nurse now. Like, I need to know what's going on. So they got like this little resident on the phone who's like in his first year of med school or whatever. Like, they got him to talk to me, and he had no idea what was going on. He had just come in and he was like, well, we had to re-intubate him. His lungs aren't getting any better. He's severely decompensated. The ventilator's not helping him come back. Like, we don't know what to do. Like, he may have hours or days left. Wow. And that was the end of the conversation. So his brother was like, no, if that's the end of the conversation, like, you're going to let us come up there. Like, you're not going to just let him pass with us not seeing him. So they agreed to let me and his immediate family, so his brothers and his mom and dad, come up there, and we could just look at him through the window. Of course, we had to like completely gown up. Even though we weren't going into his room, they still made us put everything on, and we could just stand at the ICU window and look at him.
Wow.
And they didn't like sharing information with you, right? I think they didn't really like you that much, right? Like, because you were asking a lot of questions.
Tell me I needed power of attorney, which I can't get once he's incapacitated. You can't get power of attorney. So they were trying to say because I was his spouse that I only had medical power of attorney. So I could make all of his medical decisions for him, but they would not let me see his medical chart.
That's so interesting.
Which makes no sense. I'm like, so I can tell you to put him on life support, but I can't see the note that you wrote. Like that makes no sense to me.
So this is the most alarming part, is that y'all are all there gowned up, watching him through this glass, and then thinking this is the last time you're going to see him. And then what happens?
So they called myself, his older brother, Joey, and his mom and dad into like a conference room with the resident that I had spoke to on the phone and this doctor who was just there this weekend. This doctor, I mean, he was a lifesaver. Of course, I went into the room, guns blazing. I'm like, this is what happened. They're not talking to me. Like, I pretty much chewed this doctor out, like, left and right. Like, I walked in and he was like, you can sit down. And I'm like, no, I'm not sitting down. Like, you're going to listen to what I have to say. So I pretty much, like, let him have it. I pretty much told him, like, I want to know the truth. Like, you're telling me he's not going to make it. So why is he not going to make it? Like, what are you doing? I'm like, we've requested ECMO for a week now. We're not getting any information. Like, I'm asking all these questions. They won't give me any information. I'm like, this is ridiculous. Like, I understand it's COVID times and like family can't be here, which that means your communication should be better. I'm like, I'm calling every 3 hours, asking what's his urine output, what's his kidney function, what's his blood work, like asking all these questions, and they don't want to give it to me. And their excuse was, we're not used to talking to people in the medical field.
Yeah.
Okay, well, you are. So give me the information. So we go into this conference room. We talk to this doctor. He's like, I'm so sorry. Like, I'll put a note in his chart that, they need to call you every single shift with an update. And his brother, of course, being the respiratory therapist, is like, have you tried this? Have you tried this? Have you tried this? Like, go mess with this ventilator. Try this. So they went in there and listened to his brother and made some of the changes, and his oxygen started coming back up and he started making some improvements. So they called the ECMO doctor that night and was like, look, he's a candidate for ECMO. That's why we live flighted in him there. Can you come up here now? So they came up there, and that was like at 2 a.m. She came up there, she assessed him. She called me back there to sign the paperwork. And basically she was like, we're only giving him 7 days on this. After that, we're removing it. And if he hasn't made any improvements, it is what it is. And so, I signed the paperwork. We stayed at that hospital that night till like 7 a.m. He was put on ECMO, and there he stayed for 49 days.
49 days. So
he was on ECMO for 49 days.
You just said 49 days. How'd y'all get that to go?
Yeah. You can talk.
Sorry. So from what I remember, her stating is that the ECMO doctor would call her and basically just be like, okay, well, it's this day. And I remember you saying they did.
So she had said 7 days, but during that time, she never called me again. So I'm like, okay, well, I'm not going to say anything. Just let them keep riding it out. I'm like, she ain't going to call. So it is what it is. So, there's like different settings. Did y'all see that? There's different settings on like so basically the settings of ECMO is how fast they have to put the blood into your system to replenish it. If they're doing it slower, then that means that your lungs are working more by itself. So he was on the highest settings for ECMO for a long time. And I would just call every 3 hours. I need an update. What are his ECMO settings? What are his vent settings? Like me and his brother was watching his my chart like a hawk. Like he would spike like 2 points in his white blood count. And we're like, okay, I need you to run sputum cultures. I need you to run urine cultures. I need you to run everything because he's getting an infection. And I mean, they would listen to us, and he would get an infection. So they would just like another type of pneumonia or like another type of infection. And they would give him the antibiotics and it would clear it up. So, I mean, like we literally, me and his brother knew what time they ran the labs, knew what times they run the blood gas, knew what times they did shift change. Like they hated us. I would call and they're like, hi, Miss Lara. I'm like, hey, what's going on? How's he doing? Because we couldn't have visitation with him that entire time. Like they would they would like, they're supposed to have an iPad where they would take in the room so we could talk to him while he's sedated. And so that he could hear us. Well, they would come up with excuses like, oh, we can't find the iPad. Oh, it's locked in the manager's office. Oh, it's da-da-da. So his brother got tired of that and bought Josh's own iPad and kept it in the room. So then they didn't have an excuse because we're like, hey, it's in the room. We're calling. You need to answer it so we can talk to him. So they would go in there, turn it on, and just lay it by his pillow. So we would talk to him and pray with him and do all these things. And when we were done, I would call the nurse's station and be like, okay, we're done. You can go turn it off now.
Wow. And all the while taking care of a brand new baby, 2 other kids, stressing about what's going on.
We kept the older kids were away from me for like 28 days because, I tested positive. He tested positive. So he got it when he was like 3 weeks old.
Wow.
Yeah. So he got it from me. And then actually, I'd send him away when I had it. So then he gave it to Josh's mom because they were watching him, which they were like, oh, a baby can't transmit it. Yeah, they can. But yeah, but we moved in with his parents for 3 months. We lived with Josh's parents so they could help me because there was no way I could do it by myself.
Yeah, and all the stresses and trying to keep up with the family and keep your head and your focus and your hope and all that. It's just crazy. So after, what was it, 49 days?
So 49 days, yeah. We eventually
was it progressively going up? Like, was he progressive? Like if you looked at a chart, was he getting better every day or no?
No. So pretty much they let you like coast on it, which didn't make sense to me because she told me that she only wanted to give him 7 days, but the first 4 days, they just let you coast on it. They don't try anything. They don't try to move it. They don't try to do anything. They're just trying to let your body get used to this foreign object putting blood in and out of your body. So I'm like, how are you going to give him 7 days when you haven't done nothing for 4? Like, how does that work? But no, he pretty much stayed stagnant the whole time until like the week that he started getting better. Other than that, he was just like on the same settings the entire time. They would try to lower it a little and he would do okay for a little bit and they would have to go back up.
Was it a separate occasion when they asked you, didn't they ask you, are you ready to pull the plug? Was that?
Yeah. So, we didn't have visitation. Then I don't know if y'all have seen, but there's a Houston Chronicle article about like their news crews going into the Galveston ICU to see their COVID patients. Well, they talk about Josh in that article, but they're like, there's a 31-year-old on ECMO. This is the last ditch to save his life, all this stuff. And then they took a picture of his hand and posted it on the Houston Chronicle. Well, I knew it was his hand, but they tried to say because it didn't violate any HIPAA, because they didn't use his name, nobody else could tell that was him, that they didn't break any laws. But I'm like, well, you're allowing a news crew in your ICU, but I can't come see him. So the next day after that, we had like visitation for like 30 minutes is what they gave us. So I drove to Galveston every day for 30 minutes to see him, just talk to him, sit there, play him music, that kind of thing. So, he's coasting on the ECMO, but they pretty much told us he needs a double lung transplant. So they put him on the transplant list at St. Luke's. He was on that list for forever. And they would call every day and check his status and then check to see if they had any beds open, but no beds ever opened. So basically they told us they were just keeping him on the ECMO until lungs became available. So they weren't really doing anything. They weren't trying anything like progressive. They were pretty much just letting him lay there and not do anything. So they gave us that conversation. So we're like, okay, he's on the transplant list. This is what we're waiting for. This is what they're doing. They're going to keep him alive for a transplant. Well, then 2 days later, the chief medical officer calls us in for a family meeting. So his parents, me and his brother go up there. And this is when the ECMO doctor gets on there and she's like, look, remember, I told you 7 days and we're 40 days past that. She's like, I remember I only told you 7 days. And I'm like, okay, well, you haven't talked to me in 40 days. So that's not my fault that you're not communicating. And she's like, he's not making any significant progress. We're not able to change anything. He's on the max amount of settings. It's very hard to get lungs. We don't think this is going to be a possibility. We don't know his brain activity because he was still sedated and paralyzed this entire time. They're like, we don't know his brain function. We don't know anything. So, we really think you should consider withdrawing care. And me and his brother are like, absolutely not. Like, not until you can give, like, is he in pain? And they're like, no. We're like, is he suffering? And they're like, no. And we're like, okay, then there's no reason to take him off of it. Like, why, until you can give me a reason to take him off of it? Like, if they would have came and been like, hey, he doesn't have any brain function. Like, we don't really see him improving. Okay, well, then we would have considered it. But they couldn't give us any reason why they wanted us to withdraw care. So we said, no, keep going. And then we asked them to, at this point, he had a trach. So they had took the tube out of his mouth and moved it to his throat. And he was still having the same problem where it was leaking and he wasn't getting air. So we asked them to change it and they were like, no, we're not going to change it. It's too risky. And we're like, well, you're telling us he's going to die anyway. So why not try it? Like, why? This may help him get better. So why not try it? And she was like, are you willing to sign that form? And I'm like, yeah, I'll sign it right now. Like, trade it out. So they did it, even though they didn't want to. We sat in the parking lot the whole time, waited for them to do it. He came out fine, of course. And that was that. They were like, we'll have another meeting in 3 or 4 days to ask you again if you want to withdraw care. And I'm like, okay, whatever. So because Galveston is a teaching hospital, you have a new doctor every Monday. So a new team starts every Monday. And so the chief medical officer was on this week. That was on a Friday. They asked us to withdraw care. We're like, nope, sorry, keep going. Well, the chief medical officer got mad that we didn't agree and, took Josh off of all his breathing treatments, like took him off stuff that was helping him, removed all that. And we're like, why? Like, we told you to keep going. Like, why are you taking these breathing treatments off? Of course, he was nowhere to be found. Monday, a new doctor started, put a Josh on double breathing treatments, added physical therapy to come in and start moving his joints, started removing the sedation, started removing the paralytic, and, Josh started opening his eyes. He started, like, the nurses would ask him, like, are you in pain? And he would, like, blink once for yes, twice for no. Like, he was responding to verbal cues. So we're like, okay, well, you can't tell us that he's brain dead now because he's responding. And so keep going. So they kept going. I think that was on a Monday. And by that Saturday, they were taking him completely off the ECMO. And he was decannulated on that Saturday and was on the ventilator for like 2 more days. And they started weaning him off the ventilator. It all happened within like a week that he started getting better after being like this for so long. He was on a ventilator for 60 plus days and he was sedated and paralyzed for like 70 days. So, it's just like, it took that one doctor to just go in and try to be aggressive and proactive for things to start turning around.
What was that doctor's name? Can you say?
His name's Dr. Duarte.
Duarte. So he came in and like, y'all just had this conversation of, do you want to pull the plug? And then to just completely recover, like, what if you I know you would have never chose differently, but what if you did and you knew that days later he would come back? That's wild. And so he started getting better. And I imagine there's a lot of therapy that you had to go through because he's laying in bed for a while. And did you have to learn to talk and stuff, all that stuff again? How'd that go?
Weird. Because of the trach that it was in my that they had is a balloon that when they inflate it, you can't talk. So which when we do have a trach, you're not supposed to talk at all. You're not supposed to any type of voice, anything. But I was different apparently. I think, I don't know. I think I video chatted you or something.
Yeah. So you're not supposed to talk over your trach because that means that you're collapsing the balloon and you're not getting the support from the ventilator. So because he had such a leak in his trach already, it was already collapsing. So he just kept talking over it. And they're like, hey, you're not supposed to do that. So they would go in and air it back up and then he would get mad that he couldn't talk. So then somebody else would come in and like deflate it because he wanted to be able to talk.
It was the weirdest thing because it was like my mouth was moving, but nothing was coming. It was almost like a bad nightmare. It freaked me out a little bit. So that's kind of I was hitting my bed, like paging the nurse, someone like, hey, I was just pointing like, I need to talk,
And do you remember being out and then waking up? Do you remember that time of being out, or were you just back and you realized that you had this equipment going down your throat and hooked up to all the machines? Do you remember? Was the last time you remembered when you got COVID on like day set, or like when they actually intubated you? Is that the last memory? And then it was you coming back?
Yeah, that was basically I remember holding my sister-in-law's hand. And I remember her crying, and I thought that was it. It was almost like see you later in a way.
What
and
was it, like a snap of a finger and you were back, or was there anything that you witnessed in the middle of the time? Like,
yeah, man. Oh yeah. So my wife was saying that they would play music when they would call me or anything like that. And then of course my wife would play different genres that me and her liked, and she knew that I liked. And then my brother Joey, he knew what me and him liked. So he would play me heavy metal music while being sedated. So, your Slipknot, Mudvayne, stuff like that.
Whereas I would play like Incubus, like calming music, Bruno Mars, Ed Sheeran.
So man, yeah. So I one of my hallucinations was I thought I was wheeled out into the back of the hospital outside, where like dumpsters and people where the linens, dirty linens would go, and people would come pick, just like you're shipping stuff. But there were other patients out there too with me, and there was this nurse out there, and I remember her kind of just not really saying anything, but just kind of park me to where I would look at. There was a screen on the wall, and she started playing Mudvayne's song, Dig. And she would come up to me and she'd be like, "Can you hear it?" And I'm like, "Or do you know who that is?" And I'm like, "Yeah, I know who that is. That's Mudvayne. Like, what do you think? I know. Don't try to test me." And she was like, "Okay." So then all of a sudden she switched it over to Slipknot. And I'm looking at the screen, and all of a sudden there's just like things spinning on the screen, and I basically go and like, to me, I thought it was like hypnosis. But then I look at the nurse and she's like, "Can you hear it?" And I'm kind of like telling her like, "Yeah," but to me, I couldn't hear it. Like I couldn't hear any of the music. I can just see it. So then at that point I was like, all right, well, is this the first sign of you dying is not hearing anymore? And this is what they're doing is bringing me back here for me to die. And so I'm looking at it, and yeah, man, there's she wheels me up right in front of the screen, which I think is happening. And I get lifted up in the air, like kind of like in my wheelchair's wrapped in a chain, and this person is pulling me up, raising me. And all of a sudden I see this weird figure kind of like off to the side of me. And I'm like, what are you doing? And I'm just kind of like trying to talk to her, get her attention. And she's like, "It's all right. Everything's okay." And I'm like, what are you doing? And all of a sudden, man, she has this big sawzall and sticks it in my back. And she's like, "Just it's okay. Everything's fine. Just breathe. And I'm like, no, like, get me down. Get me out of here. And then all of a sudden, like, I just started blinking, and that's it. It kind of just goes blank after that. So yeah.
So the songs that he was hearing and the stuff that he remembers hearing is actually stuff that actually happens around you. They say, like, you know, they have these big hallucinations when they're sedated, but like the Mudvayne and Slipknot that he heard was actually his brother playing those music for him. And like some of the conversations where he said he like heard people like betting on him if he was going to die or not. And those conversations are basically his team, like the doctors and stuff in the room, having these conferences about how he's doing. So a lot of stuff he thinks is hallucination from the sedation and stuff, with stuff actually happening around him while he was sedated.
Yeah. What she was saying about the doctors, I was in a room, a red room. It was just red. And there's other people just there. There was this little figure in front of me and this big figure right beside it. And they were just facing forward, looking at TV. And there's just screens of people like basically playing poker and looking at the patients on ones that were potentially going to die and make big bets. And there was even a baby in there with me, beside me. And there's just nurses and stuff playing. I think I was like, one of the nurses said I was like hitting my chest, like say, I'm not going nowhere. Like that.
He was like doing CPR on himself.
Basically, like just hitting my chest, boom, boom, hitting it hard. And I was like, I'm not ready, you know. And they would play music, and they said, "Well, do you want to watch a movie?" So I remember this. They put on, I guess I told them put on Friday Night Lights. And as I'm watching a movie, within the movie, there's a scene with the coach that's talking. Well, that behind that scene, there was a voice that I was hearing, and I thought it was a doctor that was basically talking to me and asking me, why do I think I should live? And I briefly remember stating, well, that's because I'm not ready to die, because I have too much to live for. I have my newborn that I won't be able to see grow up. My kids. I said, I can't leave my wife. And they said, well, why would I choose you over the other three? I said, well, because I said, I believe in God. I said, but if this is my time, I want to be it for the right reasons. And I said, he gave us a choice to live. And I felt like I'm not there yet. And after that, it went blank. And
so when they started weaning like the sedation and paralyzing medicine, you know, he was on some pretty strong stuff. You know, I don't know if y'all know the drug that Michael Jackson overdosed on, fentanyl. He was on that. He was on all different kinds of pain meds and sedation meds and all kinds of stuff. So when they started lowering that, he had really bad withdrawals, you know, hallucinations. He would be FaceTiming, because we gave him, once he started coming to, we gave him like his tablet and his phone. But during the night he would have, you know, those hallucinations, and they basically call it ICU psychosis, to where he would be like freaking out. He would be calling me like in the middle of the night, like they're trying to kill me. Like there was an antenna in a ceiling that was like for his TV, and he'd be like, they're watching me in the ceiling. Like he would just be freaking out. Like I've never seen that look in someone's eyes like I saw the nights where he would call me freaking out, just because he was scared. I mean, he was by himself. He was withdrawing from medication. That Josh has been one that never likes to take medication, and he was on all these strong medicines for so long and having significant withdrawals, throwing up, shakes. And then they would give him more, trying to control it. And then it would be a cycle all over again. So we basically had to tell them, like, do not give him any more pain medicine. do not, if he starts hallucinating, like, do not give him anything. Like, put us on the phone so we can talk to him.
Yeah, I think I was up for 3 days straight.
Yeah, he was awake for
What?
3 days. We're like, he has got to sleep. No, he was awake the
Yeah,
entire time because he was afraid to go to sleep.
And that's not good for all this recovery. You had to sleep.
Yeah.
No.
Oh wow, I don't know. That's a hell of an experience. Do you think that's a mixture of drugs and spirituality, and how much of that do you think was the drugs or him like actually fighting for his life? I mean, I guess he can't really say what it was. Well, maybe you could.
Man, it's hard. It's very hard to explain because some of those hallucinations, when they had put me in another room, they had put me facing a window. And again, this was me weaning off of the drugs. And yeah, I think I can state that I know what was the drugs, but then again, I can also state what was spiritual because, again, man, there was other hallucinations I had that I thought I was done for. Like I thought I was kind of like in a wheelchair, like in a not on a roller coaster, but you're like in a seat, and it's a track that was basically moving you down, basically down to hell, and it was just I can see this fire, and basically that's where I thought I was going. And then I again, my dad called when I'm answering the phone, and he's like, "Son, what are you doing?" And I don't know. Like, what am I supposed to do? And he's like, "You're not done." And I'm like, "All right, well, I'm not done." So I'd hang up and be like, "Hey, get me out of here. Get me off this thing." And
Josh is the worst patient ever. The worst.
And then going into that room, which I knew was potentially the drug, for some reason, I don't know why, there was, chicken pot pie,
Of course.
was basically coming down the window. And I was just like, what the hell is going on? And I just closed my eyes. It's just dripping down the window. And this is when they started bringing in like care nurses, or
They're called basically babysitters,
Yeah.
because he was like hallucinating so much. They thought if he had somebody there with him that it would help him. So basically it's just a person that's like a nurse aide who comes and sits with you the entire time. Well, of course that didn't work. So we had the psych doctor approve for somebody of his family to be there for 24 hours at all times. So we had like an Excel spreadsheet between me, his mom, his dad, his brother, and his other brother of somebody who was there 24 hours a day. Like we would take 12-hour shifts. And like I would be in there from 6 to 6, and then his brother would get off work and go there from like 6 to 6 the next morning. So they allowed us to be able to stay with him the entire 24 hours. And that really helped his hallucinations and his sedation. And it really helped the nurses because they didn't really have to do a whole lot because we were there. So if he needed to go to the bathroom, we cleaned him. If he needed a shower, we cleaned him. If he needed to turn in the bed, we were the one turning him. So it was good for him, but the nurses also liked it too because they didn't have to work as hard.
Wow. And I can't believe, like, being gone for so long and then coming back and then only to come to hallucinations. It'd be hard to maintain your grip on reality, like you not knowing you really are back, because what reality you're used to is not the same. You're seeing pot pie dripping down the wall and listening to music out by the dumpster. It's like, man, you had to have a lot of mental strength to get through some of that, because you could definitely freak out in situations like that. So that's
they would put every day. I think this started also going back to Clear Lake. We are Catholic, and our faith is the little holy water and stuff. And my brother started rubbing holy water on my body, my whole body, And my mother would actually, on a rainy night, drove to 3 or 4 places of family members that had different types of holy water
From like the Holy Land
from the
that
Holy
they
Land.
collected.
And they gave her some and gave it to Joey, and Joey would come in and rub holy water every day. And they also, I had a priest come in and read me my rights, my death rights. So in a way, I was going straight to heaven if anything happened. And then, of course, at Galveston, they did the same thing. Just in case had a priest come in and read my rights, prayed over me. And, certain, again, if you're a religious person or not, I've told this story too, that there was a day where my oldest brother was there, and and I could smell it, but I just didn't mention it. But it was like this flowery smell in my room. And the nurse that was there with me that day, she had came in, and other people were coming in and out. But she kind of asked the nurses and my brother, like, "Hey, do y'all smell that? It's like flowery. Just, somebody come and spray in here, because
she was like checking for an air freshener."
Yeah, they had the cleaning people come in and clean and everything, but they would never spray anything. So everybody was like, "No, like I don't smell it." And then I told her, I said, "I do smell smells like roses, And sure enough, the nurse, she was Catholic, and she called my wife and asked her this question, if she knew about it, that in the presence of that I guess there was a presence in my room of the Virgin Mary that was by my side. And my wife called my father, who's knowledge of Catholicism, and she asked me. He said that is true. That if you do smell roses,
she's in your presence.
She's in your presence. So again,
they had a priest come that day.
Yeah, and that same day, a priest came.
We put holy water on him every day. His dad did like Facebook lives every 3 days doing like praying the rosary. One of the nurses at Clear Lake had a rosary that was blessed by the priest when she went to the Vatican, and she gave it to Josh, and it was hanging on his ventilator.
My name was on my name was on the Vatican.
Yeah, we had put him on the prayer list at the Vatican.
Russia,
like everywhere. Definitely God had his hand in it, because he shouldn't be here. Everything they said, he should not be here. Medicine could not cure him. They tried everything. And we keep telling him he's our miracle man, because there's no other way to explain it. How one day they want us to withdraw support, and 2 days later you're getting better and they're taking you off the ECMO, when they said that was not even a possibility. So, none of us know how to explain it other than there was a higher power.
It truly is a miracle. And that's why I wanted to talk to you guys. And I felt like I didn't, of course I didn't live it with you, but Courtney gave me updates every day, and I got involved and emotional, and we prayed, and to see you recover too, against all odds, it's amazing. I'm really glad you're back.
Thank you.
To get back on the timeline, how many days after you wake up are you in the hospital, and then you're able to get out? How many more days do you have to be in there?
So it was basically until I was, I had to wean off of everything. I had to wean off the trach. They had to downsize it from a 8 to a 4, which was the smallest. And after that, they would take it out. And then my hole would close up on its own.
So I think he was pulled off at ECMO because he had to test negative twice. So he tested negative on the 19th. I don't remember what day they pulled him off the ECMO, but he left the hospital on October 4th is when he finally left Galveston. So he was at Galveston from July 24th to October 4th.
And then waking up, they had me doing therapy.
Yeah. So he was slowly doing therapy, speech therapy. Like they had to test his swallowing because, he hasn't had anything in his throat for that entire time. So they had to check swallowing. They had to check, could he sit up on the edge of the bed? Could he do these things that he would need to do to be able to get out of the hospital? So about mid-September, I think, is when he was taken off the ECMO. And then, he was just on the ventilator. And then they said, your progression to go up to the ventilator is like regular oxygen, high flow BiPAP. So coming off the ventilator, you have to go through all those transitions again. So you have to go from ventilator to BiPAP to high flow and when they started taking him off the ventilator, they tried to put him on BiPAP. And he just flew right by it. They were like, he doesn't even need the BiPAP. So we're just going to go straight to, they call it a trach collar. So basically you get oxygen through your trach. And, like one day they're like, okay, we're going to try BiPAP. And then I called and they're like, oh no, he's on the trach collar. And I'm like, whoa, like slow down. What is going on? Like freaking out. Cause I'm like, they're moving so fast now. Like it was like next day. And then they're like, okay, we're going to put the speaking valve on. And when you put that on your trach, it restricts your air. So then he's having to breathe more by himself. So then we're like, slow down. Like, are y'all just trying to get him out of here? Like, what is going on? And he just started doing that good to where they were like, okay, like his birthday was September 30th. And that's the first day he got to eat food. They cleared him.
Oh, wow.
They're like, we're going to test you to see if you can eat. And they're like, what do you want? And he's like, I want cheesecake. So I was there for his swallow thing, and the speech therapist brought him cheesecake. He still didn't have his taste or smell or anything. So he was like, took one bite and he was like, no, okay, I'm done with this. But that's the first day he got to eat. And then, so that was September 30th. He turned 32 in the hospital. And then 5 days later, on October 4th, we were going to a rehab facility for the company that I work for, where it's just a rehab hospital. So for him to be able to go there, he had to completely be off the ventilator. So they did a trial for 48 hours with him off the ventilator. And as long as he was off 48 hours, he was good to go. So they moved him at like midnight, of course, to the rehab hospital, the worst time ever. And then he was at the rehab hospital for a month.
Geez, that's in comparison to how long you were sick.
Yeah.
That doesn't even make
recovery.
sense. That doesn't even make sense. It's all miracles.
No.
The other blessing that I think I heard right is that both your jobs paid you the entire time. Is that kind of true?
His job did. I was on maternity leave and that's FMLA, so you don't get paid for maternity leave. And then I took a leave of absence, but his job paid him the entire time, his full salary.
And they were rooting for you too, right? And that's part of it. The reason they continued to pay you, they knew the hardship y'all were going through, and that's amazing too. That's
oh yeah.
I can't find a lot of companies that'll do that for you anymore.
No,
and especially kept his health insurance the entire time. They could have taken that away. They could have filled his position. His last day of work was July 2nd, and he just started going back to work last week. So that whole time he wasn't working.
Yeah. And then when I was up, of course, up and everything, she had finally told me that my company got bought out by another company. And I'm like, whoa, do I still have a job? And again, my boss, the owner, was man, he's an awesome person, Mike Miles. He would call her and just keep her updated on everything. And he would tell them about me that they need to keep me on, and they did. And the new company, basically they had to stop my pay end of October, and then they kept my insurance all the way until December going. And then, of course, after that, I had to at least try to come back working to, of course, have my insurance going and everything. So. Yeah, man, my company, they took care of me. Kevin Jeter, my boss, man, he's an awesome guy. Again, I don't think any company would have done that.
No.
That's amazing. And y'all have been together since y'all were was it 14?
15.
15. So y'all have already been with each other forever, loved each other, but you had some like the greatest person in your corner fighting tooth and nail. They were getting tired of her. Your brother worked there. He was second guessing everybody, but how much closer has y'all's love grown since this moment and being back and getting a second chance and seeing your baby for the first, time in a long time? Like, how's that experience been since you've been back?
Man, I can't take my eyes off my kids and my wife. Every second I gotta just look at them. Cause like I said, man, I learned something after, it's just to enjoy life no matter what, never be in a rush, never take life for granted, never take breathing for granted. Even right now, me struggling to get a cup, from the second shelf of my cabinet, takes a lot out of you. And so I've just learned just to enjoy it and enjoy every second. And that's what I did. I wanted to see her every day when she came in.
We would try to send other people to give me a break, and he'd be like, "Where's Ashely? Where's Ashely?" And I'm like, I have to sleep at some point. Like, I understand you can stay up for 3 days, but I cannot. So, we tried to like fill in as much as we can, but I pretty much stayed there pretty much every night for a while, to where like his family would have the day shift and then I would go at night. And, I do physical therapy for a career. So it helped that when he was there, like when he was sedated, I would work with him. I would be moving his hands. I would be moving his arms. I would be working on stuff. And then, when I would be staying with him, he'd be like, "I need to go to the bathroom." I'm like, "All right, well, let's flip. Let's turn. Let's move these muscles." And they'd be like, "You're pushing him too hard." I'm like, "No, he needs to work. Like, he needs to start moving these muscles. Like, he needs to work." And for me, it still seems so real. Like seeing him after, looking at him for so long, not awake, just completely sedated, not able to respond to anything. And then seeing him now, it still feels like a dream. Like, I just look at him like, I didn't see your eyes open for 4 months. And to see that first moment of him opening his eyes, the nurse called me like right away on FaceTime. I was at home, or him like waving his hand. Like they were like, "Hey, it's Ashely." And he like moved his hand. And that was like at 5 a.m. in the morning, one morning. And they called me, and just to see those moments and to see him now, it still doesn't feel real.
Man,
I still call him every 2 hours to check on him.
It's a beautiful story, and it's kind of the hospital side of it. It's kind of unfortunate, but I think you're have some action with that as well too, right? We'd hate to see this happen to someone else. Not the entire hospital, but some of the members of the hospital. It doesn't seem like they tried their best. Just going off your story.
So they kept trying to like use the excuse like we're short staffed. We don't have that many. So they have like 5 ECMO machines there. So you can only run 4 at a time because you need an extra as like a backup. So they kept saying like, we don't have nurses to run this. We're tired, whatever. And me and his brother are like, look, we've worked in healthcare this entire time. Like we're tired too, but that's not a reason to take somebody's life. You know what I mean? Like out of the 24 people that were on ECMO, that entire Delta wave, from last I heard, only 3 came off at ECMO. The rest passed, and Josh was the only one to come off the ventilator. So it just makes you wonder, like, how many people that don't have the knowledge just listen to them and were like, "Yeah, would y'all care?" And those people passed. Like, I think every day, like, what if I would? I mean, not that I ever would have, but like, what if I would have just said yes? And wouldn't get this moment with him now, and him seeing our kids grow up, like. That to me is scary, because how many more people could have been saved if we would have just given them the time to heal and the time to try to get better, instead of being like, okay, there's nothing else we can do. That's what's scary to me is, I understand you need a bed, but at the same point, are you willing just to end somebody's life who could recover because you need another bed to put somebody in? So I think about that every day. Like how many people didn't have the knowledge to fight for their loved ones.
And I'm worried about how, I know statistics, numbers, and things matter, but just the conversations that he was listening to unconscious of what the statistics were, like what the likelihood of him surviving. That should be never conversations in the room of the patient, because they're listening to everything. That's like the one sense they still have. And I don't like how he generalized people. Josh is more than a number. He's a dad that gets to come back and take care of his family, gets to be back in his family. It's like, but we talk about these numbers all the time. We shouldn't generalize it like that. We need to try our absolute best to recover patients, and there's still a hope factor. A hope factor really travels far. There's endless stories that you can listen to online of people that, against all odds, they were able to pull through. It's hard to make that a factor because it's kind of a mythical variable, but it happened with you guys, and you're back at home, and they got you back, and it's a great story. So I really appreciate you sharing it with us.
Yeah,
Thank you.
Yeah, now it's I've started and been writing a book, and
oh wow,
I started a group on Facebook for ECMO survivor patients, COVID patients, just for them to come on there and just share their story. And then I think that's it that we've been doing.
I think that's
just
great.
trying to find foundations that trying to show my support for those ECMO COVID patients. So researching every day of new news on ECMO and sharing it, and finding out other people that are surviving and off because of ECMO, people that have been on it longer than me. I'm talking like 100 days.
Yeah, 149 days, 150 days.
So man.
I think that gives the doctors the knowledge base too, because you get enough people that have survived after those days, and then they're like, okay, well, maybe this is normal, and maybe we can recover. So it takes you, starting something like that up, and it also gives people hope, because I think me and John, for a while there, we didn't think that you could survive off a ventilator. Once it's like you said earlier, it's kind of like a death sentence. So to know that people are recovering, it gives you hope, and it doesn't make you think that this is got to be your last option, and it's not. There's no way you're going to recover. I mean, especially since 3 times that other person 149 days or 200 days. Like, I'm sure that's expensive to the hospital, but the person is priceless.
It is, because I think they said it costs like $8,000 to $10,000 a day to run the ECMO machine. So what did the ECMO nurse call you? Like $1 million man. It's very expensive, but the problem is there's such a shortage of ECMO machines. I mean, some hospitals only have 3, which means you can only run 2 at a time, because you have to have one of them as a backup. Mm-hmm. And just the criteria to be on ECMO is so hard. So it's definitely something that is helping people, but I think they need to look at their protocols and try to expand them and revisit them, and, try to give people more time. Like, yes, I know it's expensive, but if you could save someone's life, like what's money to that? I mean, I understand it's a business and whatever, but if you can save someone's life, like, that's what you went into your career to do. Why not try to do it?
Yeah. And that, even being on ECMO, the downside that my father had told me, speaking to the doctors, well, what is the downside of him being on ECMO for 100 days, amount of days? Like, and he said, well, he could potentially lose limbs, fingers, toes, arms.
Because basically the blood only supplies your main organs: your heart, your kidneys, your lungs, your brain, your spleen, or whatever. Like, it just runs your main organs. So you run the risk of losing limbs. And I mean, that's something I had to sign off on for them to be able to put him on it. And there's those problems. There's, risk of other infections. There's risk of blood clots. Like, he had to be on heavy doses of blood thinner because you can't get a clot in that machine because it'll ruin everything. So, I mean, there's just so many other variables that have to go right for you to be able to survive it, which is, I mean, it's so crazy the amount of things that cannot mess it up to where they're like, okay, we can't do it anymore. So
Well,
all the stars just aligned.
it sounds like every aspect of the story, everything just happened to work out. And I hope that your story and you escalating these situations can save more lives, shine light on these specific situations that allow other people to have a chance at life again. You got anything?
No, I appreciate it. It was a great story, and I'm glad you made it.
Yeah. And
I appreciate it.
and stick around. I think we're gonna take a picture. We like taking a picture of all our guests together. But yeah,
Awesome.
thank you.
Cool, man.
Sounds good.
Thank y'all. Thank you so much.